Hello, this is Daniel with Clarify. This training is specifically in regards to our new form. The public health response to COVID-19 depends on comprehensive laboratory testing data. To comply with the CDC's critical mandate, our lab must require additional information for all COVID-19 tests. We would ask that effective immediately that this new updated form be the only form in use at your facility. I'm going to walk you through a few demos that we've created. As you can see, our new form is very similar to our previous form, with just a few minor updates. The first thing I want to point out is that we do require that you fax or securely email this form, face sheet, and provider order to this number or send to this secure email before texting for pickup. I have two demos that I'm going to review. The first is a resident demo, and the second is a staff demo. In this first section is where you would write your facility information. You would put the clinic or facility information, name here, phone number and fax here. If the resident is affiliated with a home health agency, you could write their name here with phone number and fax. And we would ask that for every sample, you do put the ordering provider's name here, phone number and fax, and then we have sample pickup location. For this sample, we have it at this assisted living facility at this address. For patient information, we would ask that you use legal last name and first name as it is on a government issued ID, gender, birth date, phone number, last four of the social, address, and county in which they reside. We understand for many of the residents, the address and phone number would be that of the facility in which they reside, and that's just fine to put that information here. The next section is for insurance information. You'd put the insurance plan name here and the policy number here, and group number if applicable. The next section is for any associated diagnostic codes that apply to the individual. This next section is PCR specimen information. We're not going to review this in detail in this training, but we'd love to have a presentation where we could talk to you about the advantages of doing PCR testing over culture and sensitivity testing for urinary tract infections, gastrointestinal, open wound, nail and perinatal, urogenital, ophthalmology, and otolaryngology. For this individual, we're going to go right into the respiratory and COVID-19 specific section. As you can see here, there are two sections. One is for patient and resident only, and the other is for staff only. For this one, being that they are a resident and symptomatic, it's marked here that they are symptomatic, and they're going to receive the full respiratory menu as well as the COVID-19 test. This was done using a nasal pharynx swab, but I do want to point out that with the full respiratory, if the individual is symptomatic and has a sore throat, or they have excess sputum, you may do all three collections and put it in the same PCR tube. There's major advantages in doing a full respiratory menu with COVID-19 if the individual is symptomatic. Mainly, if they are negative on the COVID-19 test, but they are symptomatic and are sick, it's important to know what they do have so that they can get on a treatment plan and get better as soon as possible. On this section, the individual was symptomatic with fever and shortness of breath, and those associated diagnostic codes are listed here. One of the new additions to this form is date of symptom onset, which was placed here. For this individual under exposure, it was marked as suspected contact with a person with COVID-19, and that associated diagnostic code is here. And then the CDC is asking for these additional questions to be answered. 1, does the patient identify their race as, and here it is marked as Caucasian? Does the patient identify their ethnicity as? Here it is marked not Hispanic or Latino. Is this the patient's first COVID-19 test? Yes. Is the patient currently hospitalized? No. Is the patient currently in the ICU? No. Is the patient pregnant? No. Is the patient a resident in a congregate care facility? Yes. Does the patient work in healthcare? No. And this last section is for the collection date, collection time, and then who administered the test. So who actually administered the nasopharynx swab, and that name was placed here. For this next section, it's the staff-only demo. So here, this person is a staff at this facility. And of course, they are not associated with a home health agency. However, if the staff member is employed by a home health agency, you would write that here, and you would write NA here, associated with the phone number and fax. Being that this is a commercial laboratory, they are required to have an ordering provider for every sample that's sent in. So the ordering provider's name here with associated phone number and fax. And then again, you would put where the sample pickup location is. For this individual, again, you would put legal last name, first name, and gender, date of birth, phone number, last four of the social, address, and county in which they reside. For this section, they would put their personal insurance plan name here, policy number, and group. If the individual does not have insurance, you would simply write no insurance in this box here. This is for associated diagnostic codes. Again, we're going to skip this section here. For this, they are a staff. And so they selected only COVID-19. The nasopharynx swab was the swab that was used. For symptoms, there were no symptoms, so they marked NA. For this individual, they marked known contact with a person with COVID-19 with the associated diagnostic code here. I do want to point out that Z11.59 can be used for surveillance or mandatory testing, and it's specific to COVID-19. And then the additional questions here. Does the patient identify their race as, and they marked Black or African American? Does the patient identify their ethnicity as, and they marked not Hispanic or Latino? Is this the patient's first COVID-19 test? No. Is the patient currently hospitalized? No. Is the patient currently in ICU? No. Is the patient pregnant? Yes. Is the patient a resident in a congregate care facility? No. Does the patient work in healthcare? Yes. And then like above, collection date, time, and who actually administered the swab. If you have any questions or if you need any assistance at all, please do not hesitate to reach out to us. Our main line is here. And then again, this is the number for text for pickup. Thank you and have a great day.